Good morning, good afternoon, and good evening, depending on the time this video is reaching you out. I am so excited as any other day for me to dive into another topic or share some of the health awareness to you people. And please help me to share and to comment and ask any question that you have. I am free. I am ever ready to answer your question. Some few days ago, if you could remember, I say something of this nature that very soon, by the special grace of God, I am going to be talking about one of the interesting topics that I'm going to digest with you. And that is pharmacological action and the long term use of oral or emergency contraceptive. That is oral contraceptive. That is levonorgestrel in particular, to be precise again. This particular drug is very useful and is helpful. But there is a say that say all drugs are poison, but not all poison are drugs. Meanwhile, drugs can be useful if you use it in a good way, if you use it the way it's supposed to be used. And if you use it for a very long time, or if you use it inappropriately, it will lead to another problem, that is health challenges that many people are facing. But this, I am going to bring this awareness in order to help the the current woman and the upcoming women, the one that they want to conceive or they want to be, they want to be fertilized, not to be infertilized, because infertility is rampant now. And because of the certain issues, certain things that we are doing that led some girls or some ladies or some women to that. I am not saying all, but I'm going to dive into this topic so that so that many girls or many people will have the knowledge so that they will prevent themselves from having this health problem. And this levonorgestrel is very effective, is very useful. If not because of that, companies, that pharmaceutical companies, will have not even bothered to produce this particular drug. But it's very useful, and that is why it's being used after unprotected sex within 72 hours. All right. Now, if you check that picture, you see two set of there is two sachets of a drug, which one contains two tablets and one contains one tablet. That is the two one. That is the one that contains two tablets. Is 0.75 microgram, which is the two tablet is equivalent to that particular one that contains just one tablet, because that one tablet is double strength of that 0.75 microgram. So now I know many of you will, will be urged. They will try to know what is the pharmacological action, because that is where we are going to start with. Because the pharmacological action has to do with how this particular drug works. What is its own use? All right. So now, just listen attentively and make sure that you share it to other people, that this topic will be helpful to them, both men and women. Now, the pharmacological action of this levonorgestrel, you see, this levonorgestrel is a synthetic progestogen that works as an emergency contraceptive by inhibiting delaying ovulation. It inhibits or it delays ovulation and preventing fertilization again. It prevents fertilization. Now, in the absence of fertilization, in the absence of ovulation, in the absence of all this that I mentioned, a lady or a woman will not conceive. And that is why this particular drug is being used in order to prevent all these that I mentioned: ovulation, fertilization, and this particular drug again that is altering the endometrium to prevent implantation of a fertilized egg, even if the egg is being fertilized. Now, this particular drug, it will prevent it from implantation. I remember I said it earlier from my previous topic or my previous video that in the absence of this implantation, so a woman, for her to have a hope that she'll get a baby, is not there. It's not 100%. Despite the fact that it's not 100% sure the ovulation will be delayed. It's not 100%, but that is its major work. But prevention is better than cure. All right, that is the pharmacological action of this particular drug, that is levonorgestrel. And this levonorgestrel is very, very effective for emergency contraception. And this long-term use of this particular drug can lead to some problems, which I am going to mention now. This is very, very effective. It's very useful. If not because of that, companies will have not even tried to invent or produce them. Okay, so this levonorgestrel can lead to menstrual irregularities, and these menstrual irregularities can be in form of, for example, now you menstruate or you see your cycle every 10th of every month, and after, if you are taking this for a very long time, it will start misbehaving, it will start changing. Okay, this month maybe you see it 15th, the upper month maybe you see 20th. Before you know, it will now lead to what we call amenorrhea. That is the absence, the absolutely absence of the blood flow. I know menses is a blood flow, all right? So in the absence of that, a lady will now start coming to her senses, thinking that, if I marry, will I conceive? Or, when I'm ready as a married woman, if I'm ready to have a child, will I conceive? Because amenorrhea is there. There is no this menstrual cycle. Okay? And because this particular problem, because of the menstrual irregularity, because it changes the menstrual cycle, as I said earlier, the spotting or the amenorrhea. And this levonorgestrel also, it leads to hormonal imbalances. And these hormonal imbalances, you see, we have some hormones that are responsible in reproduction. And in the absence of that, there is there's going to be a particular or a very, very sensitive problem. All right. So these imbalances, all those hormones are needed for reproduction. So in being them are not balanced, or the way the number of these hormones that is needed for reproduction maybe is less than the way the body is in need. So this imbalance of this hormone could lead to this problem. And this particular drug, long-term use of this can lead to this problem. Can lead to this problem. So please, just let's try, and because this prolonged exposure, as I said, long-term use of this, prolonged exposure of this, this drug, it contains um, something that we call it a progestin. And this progestin, a long time use of this, can lead to this particular problem that I say, hormonal imbalance. I know there are some people that are having this problem of not giving birth. When tested, they will say that is hormonal imbalance. And this hormonal imbalance, because the hormones are not balanced for reproduction. So that's the problem, right? So please, long-term use of this, all drugs are good. All drugs are very, very paramount. All drugs are, are made for our own consumption. But how do we use it? How often do we use it? That's the problem. Most especially the ladies. You are not yet married, but you are taking this because you go, you just visit your boyfriend. You know, we are all embodied in flesh, but you say that, oh, because I I had, it should just be complained that I had an unprotected sex yesterday, with blah blah blah, but I need something that, I'll not conceive. So if she understand that particular drug, she will not be taking it every day, or she'll just be taking it like she'll make it to be her daily food, uh, something for her own consumption. But I'm just advising, no, it's very, very good, it's very, very paramount, but that is that is a problem. How do we use it? The long-term use of this particular pill, levonorgestrel. All right. Now, and there is another problem again, because this levonorgestrel increase the risk of thromboembolic events and the risk of ectopic pregnancy. And having this risk of ectopic pregnancy, the woman, she might conceive, because as I said earlier, it's not 100% sure of delaying the ovulation. It's not 100%, but it will result to another problem again, because I'm just talking about the long-term use. But we, some girls only just care that I am not, it's even better for you to conceive, not to even use it, than to be misusing it. That is the plain truth. That's the reality. So this advice is to you, married and unmarried, most especially unmarried ladies. Okay? Because it will definitely help you. Not for you after getting married, it will now be another burden or another marital challenge having between you and your husband. And this particular drug, again, levonorgestrel, it also has a great impact on fertility, because after getting married and you are not fertile, you have this issue of infertility because of long-term use, long-term exposure to this particular drug. Now you will not be having issue of infertility. It has a great impact on this problem of fertility. That is, you'll be infertile, having this challenge, that you'll be having issues in your own husband's house, because potential delay in return of fertility after stopping the long-term use of this particular drug. And now um, there are some other potentials side effects, like headache, mood changes, breast tenderness, and other potential side effects of taking this for a very long time. And there are some again, because if a lady, she's taking all these, most of these oral contraceptions or contraceptives, they'll be having, they'll be getting fatter, you know, they'll be thinking like it's a normal thing, not knowing that, in other way around, is causing another problem, such as the diabetes or some of these cardiac issues. So please, it is a great time for you to learn a lesson. And if you are being exposed to this particular drug and you don't know how can you do to get rid from that challenge or problem, you can just put it at the comment section. Any problem, any advice, you can put it at the comment section, and the special grace of God, I'll get back to you and I'll answer this your question. Thank you very much. Keep sharing, keep lacking so that other people that are in need of this vital information and health awareness to be gotten.